We don't know exactly what kind of cancer it is, but it is cancer. And just crushing. It was just a gut punch. So that morning around 8 a.m., they made the decision to intubate him.
I thought we were gonna lose him, actually, that if they didn't do that, because he wasn't breathing, his oxygen was so bad.
Well, we met, it was June 25th, 2009. She was there with work friends, I was there with friends, and we ended up sitting next to each other. I'm a Sox fan, she's a Cubs fan, and right away got into that north side, south side.
And I bought his drinks. I was an insurance broker for nearly 15 years for employee health benefits and health insurance. So we were brokers for employer groups. I knew the ins and outs of medical plans, life insurance plans, dental plans, and I quit my career after our youngest, Andrew, was born.
So I work in education. I'm currently a special education administrator for Plainfield North High School. Love being in a building that's full of life. It's not work when you love what you do.
The beginning of 2014, we found out we were pregnant with our first child. I would say Mila's pregnancy was fairly easy.
After watching her go through childbirth, then I realized that she can do anything.
I remember that day sitting in the kitchen thinking that I think I might be pregnant with our second child. If I have to go through this again for 9 months, and lo and behold, days later I did take a pregnancy test and we were pregnant with our second child. He came out perfectly healthy and we got to go home normal time. Everything seemed to be perfectly fine. At the hospital, they did say he had something called neutropenia, where his white blood cells just dropped, bottomed out. So he unfortunately had to spend several days in the hospital at 6 weeks old. All was well after those few days, and he did eventually get to go home. And at the time, we thought it was just a one-off, a fluke, and we went home and continued to raise 2 babies. Grayson had developed a rash. We did not know what this rash was from. We did call our pediatrician that day, but something just wasn't right. The next 5 to 7 days being on this steroid, while the rashes were gone, we started noticing physical changes in Grayson and also behavioral changes in Grayson. Tuesday morning, I took him to his pediatrician. We walked in that room and she took one look at him and said, "You need to go to the emergency room." They received those results from the CT scan and also the blood work, and the emergency room doctor came out and said, "It's time to go to a different hospital. You need to pick between either Lurie's Children's Hospital or Rush Children's, because Grayson, there's something going on with Grayson based on the CT scan." And those 2 options were, it's either a really, really, really bad sinus infection or it's cancer. And we quickly decided on Lurie Children's Hospital. It wasn't until 11 o'clock that a doctor came in and
The doctor came in and said, "I can't watch you guys sitting here not knowing." Said, "We don't know exactly what kind of cancer it is, but it is cancer. So we see something on his kidney. We're positive that it's cancer. We just don't know what type of cancer yet." This was roughly 12 hours later, about 2:30 in the morning. So we were up the whole time and just crushing. It was just a gut punch.
Between the 2 leukemias, there is acute myeloid leukemia, and then the other one is called acute lymphoblastic leukemia, ALL. In the world of cancer, we got the worse cancer. Statistically, AML is more aggressive. The chances of a child surviving AML is not as great as ALL.
His oncologist came in and let us know what the treatment plan would look like. Right away, they got Grayson on his first round of chemo. And so within a day or two, the swelling around his eyes went down. His mood started coming back. It was crazy to see like the effects of the chemo so quickly into what he was experiencing, and the pain that he was in, it went away. So we were very thankful for that, but we're gearing up for what we knew would be a long road.
Things seemed to be going wonderful. Things were working. Even actually after the second round, we actually did get a phone call from his doctor saying he's clear, the blood looks good, his cancer seems gone, so this is doing what it's supposed to be doing. We thought we were done, and we had tests and scans scheduled for early February. That's when we received even worse news.
We get told by the tech that Dr. Morgan's gonna come down. So right away, red flags are up, so we're very nervous about it. She comes in and she comes in and she tells us that, you know, it's not good. It's back, and this time it's in the spine and it's in the brain.
Yeah.
We were able to go home that day, that evening, and I remember it. I work in a school, we had a snow day the next day, so I actually got to spend time at home with the kids, and it was just the constantness of how are we gonna do this again?
So the new roadmap consisted of 2 more rounds of chemotherapy. Because he was initially considered moderate risk, that only included the chemotherapy. Now with his relapse, he's obviously high risk. That would now entail a stem cell transplant. But in order to do a stem cell transplant, all the cancer cells have to clear. Your whole body has to rid of cancer cells before you can actually move forward with a stem cell transplant. Nothing was helping. So they presented us with another plan, and that was radiation. That was not our initial roadmap. With the month or two going by, he's now 22 months old. Our decision was quickly yes. We without hesitation, it was either do the radiation, deal with the side effects, or he doesn't make it. So this day is called day 0. The doctors already picked this date months before. It was May 10th of 2018 was Grayson's stem cell transplant. My dad happened to pass away 3 years ago on that date. So it was a pretty emotional day. It was also very comforting knowing that his day
would be my dad's passing. And it was a sign. It was a sign that, you know, my dad was there and things were gonna be okay.
So that morning around 8 a.m., they made the decision to intubate him.
I thought we were gonna lose him, actually, that if they didn't do that, because he wasn't breathing, his oxygen was so bad.
Something was off about Grayson. It was determined by our oncology team. That landed us probably another 2 to 3 days in the hospital. EKGs, monitoring his brain. They attributed the epilepsy was due to his cranial radiation. So now that we're, 5 years from his epilepsy diagnosis, We believe that he will have this probably for the rest of his life because of that radiation. You know, they're almost certain that it damaged a part of his brain that likely didn't develop. From that point, February of 2020 till now, he's probably been on, gosh, 8 to 10 different seizure medications.
It was stage 1B breast cancer. You know, I couldn't believe it. You know, you think you've gone through hell. You think you get a free ticket because of everything we went through with Grayson.
Nina handled it. She got through her treatments. She got through the surgeries. 9 months, almost 9 months from the day that my dad passed away, my brother passed away.
You know, our family and our friends were always there for us, always.
And they continue to be.
Yeah,
We're lucky in that.
we are.
We're very lucky with who we have as our family and then who we have as our friends.
I handle the day-to-day with our kids because Jason's out the door usually by 5:30 a.m. The kids get up probably anytime 7 a.m. He has a morning medication routine along with an evening medication routine. So he has to take 3 to 4 capsules that normally an adult or maybe a younger or older child maybe could swallow. He doesn't know how to swallow a pill. I will make his breakfast, pack his lunch, pack his bag. Grayson then is picked up at school in a special door. He has care the entire day at school. He's got aides with him.
Any homework that Grayson or the other two have to do, we go into homework, and then they get an opportunity like just playtime. So we all eat dinner. The hard thing with him is his diet. Yeah. We modify his meal. So if we're doing burgers, let's say, he's eating less of a bun because we're trying to reduce as many carbs as possible. You know, being 44 and 43 years old, we're already thinking about if we're not here, how is he going to be provided for? Because I don't know if he'll ever be able to work or to live independently. We don't know at this point. Looking at setting him up for the future to where he can be cared for and not have it be such put on his brother and sister, Mila and Andrew. They're always going to be there for him, but financially, we need him to be able to be cared for and not have them be responsible for that. The fear of the unknown is really where it's a struggle. The financial impact that has, especially if it's for an individual who needs 100% of his care, being in a safe and trusting environment is something that you know, we're just starting to dive into that area and look into that, because we know what we can provide, we know what we have provided, we know what in the moment what he needs. But again, down the road, we don't know if there's any other operations that have to come up for him or any other diagnoses that are going to be a result of just as he grows and just seeing what the damage from the treatment has done. He's a happy kid, super happy. So the focus was spending as much time as we could trying to keep some sense of normalcy, letting Grayson just experience something besides a hospital room.